everyone! Today we mark NHS Day by meeting a GP and hearing about what it's like to be a GP.
Yeah, so I'm Ed's cousin and professionally I'm Dr. Clegg. And I'm a GP registrar, so that means I'm a doctor who has done several years in the hospital and now I'm doing special training to become a GP, which I should be fully qualified in a couple of months' time.
Ugly. So, why did you become a GP?
I always knew when I was younger that I wanted a career that would make a difference, really, but also something that would keep me intellectually stimulated. And so I did work experience around a few different areas because I really didn't know what I wanted to do. And then actually it was when I did some work experience in a GP that I decided I wanted to go into medicine. And then also during medical school, the time I spent in GP, I think it was the variety and the continuity of care that you get with the GP that I really liked. And I enjoyed the fact that you could get the whole breadth of medicine coming through the door, and we often do. So that's why I went for GP in the end.
Oh, nice. So, next. What can someone expect if they are looking to become a GP?
So it is a long career path. It does take a long time. So you do your A-levels, and generally you need some science in the A-levels. Science and maths are the two key ones that you'll often see. So if you're thinking about it, have a look at the university requirements because they're all a bit different. You then do 5 or 6 years at medical school, depending on which one you go to. You then qualify as a doctor, and then you do 2 years in something called foundation, which is when you go around hospital rotation. So you spend 4 months generally in hospital rotations, and then most people will do 4 months in GP as well. You then at the end of that can either decide to take a bit of time to decide what specialty you want to do, or you apply. So for me, I took a year where I worked in A&E because that's the other thing I really enjoyed. And then you apply for GP training, and it's then at least another 3 years of GP training. So overall, you're looking at least 5 years in medical school, and then another 5 years once you've qualified as a doctor to then be fully qualified as a GP. You've got lots of exams as well, unfortunately. So even when you finish medical school, there are lots more exams. And I'll be honest, it is a long path. It is quite a difficult path as well. So I would say only do it if you're really sure that you want to do it. But equally, one of the reasons it is so difficult is to give us the knowledge that we need to be able to see everything, because with GP, it can be anything and everything that comes through the door. So you need that real breadth of training.
Oh. Can I come to a GP if the problem isn't physical? So, for example, mental health related?
Absolutely. So it's one of the key things about being a GP is that we see the breadth of medicine. So we see everything physical, but we also deal with a lot of mental health. And actually, we deal with an awful lot of mental health in general practice that doesn't need to see psychiatry. So most people can actually be managed really well by their GP long term without needing to see or wait to see a psychiatrist or a psychiatric nurse. So I would say absolutely any condition that you think you're worried about, or anything, even if you think, oh, I'm not sure whether I should see a GP about this, if it's something that's worrying you, physical or mental, then absolutely we deal with everything.
So, can I approach a GP about a health issue that someone else has, such as a family member?
You can, but it is a little bit more complicated. So it all depends on something called capacity and consent. So we want to make sure that all of our patients know that their health record is protected and that we're not going to talk about their health issues to somebody without their consent. So it's a little bit different for children because obviously they are too young to consent to someone else knowing their medical issue. So parents or legal guardians do have access. Sometimes as people get older, they'll also put things in place on their record to say they want someone to have access. So for example, if you are thinking maybe, my memory is getting a little bit more difficult with time and I would quite like my child or friend to be able to speak on my behalf, you can absolutely do that. You just need to get something written. You need to write something out and get it signed and send it to your GP. But if you haven't got consent on your record, so say, for example, you came to see me, Ed, and you were asking about somebody else, if there's no consent on that record for you to talk about that person, then you can tell me anything you want about them, but I can't give you any details about them. So we can still record things that you might be worried about, but I can't give you their medical information without their consent. And you also can't diagnose. So this is another area where it becomes more tricky. If somebody sees you, say they think a parent may have memory difficulties, I can't diagnose it without seeing the person themselves. So often the better way to do it is, if you're worried about somebody, try and see if you can convince them to come with you. So you come together, and that way I get to see both you, and I get all of your concerns and your worries and your ideas. But then also I get to see the person that you're worried about, and I get to ask them questions as well. And that can work really well.
What advice would you give to someone who was worried about approaching their GP with a problem?
So I would say we see everything, and there are lots of things that people can quite understandably be embarrassed about, or things that they think, oh, I don't know if I'm wasting a GP's time. And I do hear that a lot. I would say if there's something that's worrying you, and it's something that isn't just oh, I'm worried about it one day, but the next day I'm fine. It's something continually there on your mind. Come and see us. We see, as I said, we see absolutely everything. And we do a lot of intimate exams day on day. So something that's embarrassing for you, it won't be embarrassing for us, because it's part of our job, and we'll do what we can to put you at ease. I would also say that if you're a bit more worried about coming to the GP, have a think beforehand about what's the most important thing for you. So we call it the golden minute at the start of your consultation, where we just want to listen to what you say. So have a think, what are the key things that I want to tell my GP in that time? The other thing as well is time. So time is limited. We only get 10 minutes, sometimes 15 minutes if we're lucky. So you need to prioritise the thing that's causing you the most issue, or the thing you're most worried about. And if you've got a few things on a list, probably the best thing to say is at the start, I've got a few things that I'm worried about. These are the things. And then if you were my patient, we could work together and say, well, what's worrying you the most? And then actually I look at your list and go, well, actually, I think this is the thing that worries me the most from what you've got on your list. And then we can work together to try and combat the things that are most pressing for us both. And we won't be able to do everything necessarily on the list, but hopefully then we can do the things that are worrying you and the things that might worry me. I would also say that GPs are people, and you will connect with some people and you won't connect with other people. So if you see somebody and you're not happy with the outcome of that, or you go away and you think, I'm not sure they really got my point of view, you can always come and see somebody else. So you can always get a second opinion. They may give you the same answer as the first person, or they may approach things slightly differently. And it'd be worth, I say, if you're getting a second opinion, having a think about, what is it I really want to get out of this consultation, and making that clear quite early so we can address it. And it might be something that I agree and go, yeah, absolutely, we can do that. Or we might not be able to, but then I can at least explain to you why. But I would absolutely say, if you're worried about something and it's sitting on your mind, don't just stay at home. Do come and see us, especially if it's something that's been on your mind for a while.
Oh, thank you very much for joining us today, and hope it goes well for the future.
Thank you, and happy NHS Day to everybody out there.
Thanks. Happy NHS
Bye.
to you too. Bye.
Thank you again, Dr. Clegg, for joining us on the programme. And to everyone watching, I hope you also have a happy NHS Day, and it was lovely having you here.